taking responsibility for your own health is an act of radical self-reliance. And that is why I got into naturopathic medicine. I took a course when I was at McGill University in 1986 called Food and Nutrition in Prehistoric Societies, which was, for back then, it was the first we'd ever sort of thought about that stuff. And the professor really did a deep dive into the big food industry, and I was horrified. And that's what got me interested when I learned about naturopathic medicine, which is guided by 6 philosophical principles, probably the most important of which is vis medicatrix naturae, the healing power of nature. Well, during that time, I was rock climbing, like my entire life revolved around rock climbing. And I was doing this cross-through move. I was training for a trip to France, the birthplace of modern sport climbing. I did this hard cross-through move, and I had this pop in my shoulder. And I went and saw a surgeon. He said, yeah, you've torn the labrum of your shoulder. You've torn the cartilage. I can put a scope in there, and I can cut it away. Or alternately, I can give you a steroid injection. Both of them are going to help you in the short term, but it's probably going to give you problems later in life. And I thought, those are my options? Like, that's all you have to offer? That's so dumb. So that's when I found out about Rick Marinelli, who was the first naturopathic doctor to perform prolotherapy. And we have the very famous Dr. Steve here, who's the premier prolotherapist from South Africa. Hi, Dr. Steve. And Rick did prolotherapy on my shoulder, and it resulted in a complete cure, and my life path unfolded before me. So the main concept of prolotherapy is it's the injection of natural substances which essentially trick the body into thinking that it's been re-injured, thereby launching the body's natural healing ability. So it fits in perfectly with the whole philosophy of naturopathic medicine. Well, that was in the late 90s that I started with that. And in 2005 is when platelet-rich plasma hit the scene, and the naturopaths really jumped onto that. It's exactly the same concept, except instead of using these natural substances, we just take your blood, spin down the platelets, which are what are responsible for healing after injury. The platelets are what signal your own stem cells to go into action. So we started doing that. It was a little more complex. It was a little more medical than what we had been doing, but it worked so much better than prolotherapy. Well, then this is Laura. And Laura had been a patient of mine for a number of years. And I had helped her. She had this very traumatic knee injury and had this knee pain that we had helped quite a bit with prolotherapy and with PRP, but we just couldn't quite get her all the way there. And so she came into my office. I just adored this lady. She came and dropped this stack of papers on my desk. This was in 2009. And she said, Harry, I want you to inject bone marrow stem cells into my knee. And these papers, it was all animal studies. That's all we had back then was animal studies. And I looked at her and I said, Laura, I don't know how to do that. And she said, we'll learn. And I said, Laura, I'm a naturopathic doctor. Like, do you know how much shit I will get if I start doing bone marrow aspirations? And she leaned forward and she said, Harry, I'm a materials engineer for NASA, and I'm a woman. So if you want to complain to me about people telling you that you're out of your league, afraid you're talking to the wrong person. And I couldn't argue with that. So I learned how to do bone marrow aspirations, and they're actually not that hard. That's my little secret. So I ended up there was nothing in the United States. There were only like 10 people in the United States even doing stem cells at that point. And so when I saw American Academy of Anti-Aging Medicine offered this, like what they called a fellowship, which is a loose use of the term, I went ahead and took it. And what was amazing was half the people in the audience, there were about probably like 50 people in the group, half the people were gringos, Americans like me, trying to figure out what to do with this stuff. But the other half were South Americans who had been doing it for years. And fortunately, I speak a little Spanish, so I just, asked these people, would you mind if I came to visit you and learn what you're doing? And every single one of them said yes. This is Carlos Cecilio Brat, who had this very, very long-standing clinic up in the mountains of Venezuela. And I went and spent, a week with him. And he had this big room with all these like little beds divided by curtains. It kind of reminded me of like a MASH hospital or something. Very primitive, but very clean. And what he would do is he would just go from one bed to the other and place like an 18-gauge needle into the sternum, draw bone marrow, put it in a blood bag, pump ozone gas into the blood bag, shake it up, and then he would give it back intravenously through a filter. This treatment probably cost him around 72 cents in materials. He treated everybody from illiterate farmers on up to the Chavez family. And he probably charged a couple $100 for the treatment. And he had video documentation of all of his cases. So he showed me all these, video testimonials of people. He was treating everything imaginable with this treatment. And I was blown away. From there, I went directly to Panama, to the Stem Cell Institute. Now, a lot of you people probably had heard about it before the Stem Cell Institute, but since Tony Robbins' book hit, a lot more of you have heard about it. But Neil Riordan at the Stem Cell Institute in Panama he's one of the biggest players in the field, and he has put together what is probably still the state-of-the-art stem cell clinic in the world. And I went and visited that, and having that experience of going from seeing something that was so incredibly simple to something that was just monumentally complex, the thing that I noticed, the similarity, was everybody was getting better. Well, I mean, not everybody, clearly, but a lot of people, more people than not, were getting better. What was different was the type of people that they attracted. And after having that experience of those two literally back to back, I started sort of seeing this three-dimensional graph. And I decided, in medicine, we focus on best practice, and we focus on gold standard, and there's like one right way to do stuff, and everybody should do it that way. Well, after that experience, I thought, you know what? I'm just going to do what I want done to me, and then I'm going to attract the people who think the way that I do. And so that's exactly what I did. So soon after that experience, this is Gary Young, who was one of my star patients. He was really my first celebrity patient. He had been coming to me for years, and similar to Laura, I could get him to a certain point, but I couldn't quite get him all the way there. We'd helped him a lot with his neck pain and his joints, but he had this low back pain, this midline pain, worse bending forward, and we just couldn't help him with that. And finally I said, Gary, the issue here is you have dehydrated lumbar discs, and you need stem cells injected directly into the discs. And he said, okay, when do you want to do it? I said, Gary, I don't know how to do that. And he said, learn. And I said, look, Gary, I have a friend in Texas who does that. You can go, you have a private plane, I'll go with you. He said, I don't want your friend to do it. I want you to do it. I thought, Gary, I'm a naturopathic doctor. Do you know how much shit I will get if I start injecting discs with x-ray guidance? And I said, they'll call me a quack. And he goes, oh, a quack. Whoo, that sounds pretty bad. By the way, Harry, have you Googled Gary Young lately? For those of you who don't know Gary Young, he's the founder of Young Living Essential Oils, which is one of the largest multi-level marketing groups in the world. It's like a global multi-billion-dollar corporation. If you go to Quackwatch, there's a dedicated button to Gary on Quackwatch. This guy has some serious haters. And I listened to him, and I suddenly flashed back to my rock climbing days. And when you're rock climbing, the way that you're able to achieve a high level of rock climbing is you have to understand the nature between rational fear and irrational fear. So rational fear is what keeps us alive. We need rational fear. So if you have an equipment malfunction, you recognize it, and you recognize that there's a problem, and you actually do something about it. Without rational fear, you're not going to live long. Now, Alex Honard has made free climbing, what's really called free soloing, popular, but there's really very few people actually doing free soloing in the world, because the reason is because they all die eventually. I'm talking about roped climbing. Now, the thing that holds a lot of people back is when you're climbing with a rope is this fear of falling. But if you're afraid of falling, all that's going to happen when you fall is you're going to fall at the most 10 feet or something, and the rope's going to catch you, right? But it's still scary, and it really, in a sense, flies in the face of every instinct of self-preservation. So people just don't like doing it. Well, the trick is you have to make friends with the fear. You have to be okay with it because that's irrational fear. Because you're not going to get hurt from falling on a rope, even though it's scary. And once you make that shift, suddenly you can climb at a high level. And that, for the first time when I was speaking to Gary, like really clicked for me. And it was at that moment that I just decided, I don't give a shit what the MDs think about me. I don't care what any of these people think about me. This is what I'm going to do. And so I got thank you very much. So I got an X-ray machine. I learned how to use it. And here's my little secret. It's not that hard. What it did is it allowed me to start injecting intravertebral discs and do epidural injections and put stem cells basically anywhere in the body that you want me to. Another key to my puzzle is using IV sedation. This is one of my anesthesiologists. In the early days, I used to make it optional. People had they could either do it awake or they could sleep through it. And what I figured out is that when I would call the people who skipped, I'd say, it's an additional charge and you can do it or you cannot do it. And, certain people would be like, oh, either they were afraid that I would think they were a wimp or they wanted to save a couple of bucks. And then when I would talk to those people like 6 months later, I'd say, hi, this is Harry Adelson from Doceri Clinics. How are you doing? Oh, hello. Like super pissed off at me. Like obviously icicles coming through the phone. And I'd go, so, did I help you? No, it didn't work. Oh, okay. Can you play tennis now? Yeah, I'm playing tennis now, about 5 days a week. Oh, because it says here that you couldn't play tennis because of your low back pain before. Oh, yeah, but, I started doing yoga, and I'm pretty sure that's what did it. And I said, yeah, 20 years of low back pain, and so 2 months of yoga did it, I'm pretty sure. Well, I finally, the light turned on, and I realized that these people were angry with me because I tortured them. It's very painful to go through awake, and so they just would carry that negative experience with them and convince themselves that so after that, I worked it in, it was included in the price, and that icicles over the telephone never happened again. So let me talk to you about VSELs, very small embryonic-like stem cells. I'm going pretty light on the science in this talk. I'm more just telling you kind of my story, but I do want to talk about this because this is a new addition that we've just started doing about a year ago, and it's made a big difference. So we use stem cells from the bone marrow, we use stem cells from the fat, but these VSELs are stem cells that exist in our blood. And the VSEL stands for very small embryonic-like stem cells. And we've known about these types of cells since about 2008. As the name implies, they're very small. They're slightly smaller than a red blood cell. What's nice about that is it freely passes the blood-brain barrier and it passes through your lungs. Because when you do IV stem cells, they all collect in the lungs and they dump all the growth factors and you still get benefit from it. Oh, my mom is calling. I get all kinds of important calls all the time. So these VSELs, so they actually pass through the lungs. So when you give it intravenously, it gives this systemic delivery. They're called very small embryonic-like because they're actually almost as primitive as embryonic stem cells. So when you look at this family tree here at the top, you've got the embryonic stem cells. Now, nobody uses embryonic stem cells therapeutically anymore because they're just too dangerous. They turn into tumors. They're tumorigenic. You get these things called teratomas, which are these balls of hair and teeth, in your spinal cord type thing. Yeah, it happens. I mean, it's no joke. So really, nobody's using embryonic stem cells anymore. I think there's a couple of outfits in Russia that still do, but it's not very popular to go to Russia right now. And then you come down at the bottom, you have the mesenchymal stem cells, which is what we generally talk about when we talk about bone marrow, when we talk about fat, when we talk about umbilical cord stem cells, placental stem cells. Generally, it's these mesenchymal stem cells, and they're already somewhat differentiated. So the higher up in the family tree you are, the more primitive, the further down, the more differentiated, the more it's turning into target tissue. And with the mesenchymal stem cells, we think that they don't actually turn into target tissue. The benefit that you get from it is called the paracrine effect, or paracrine signaling, where the stem cells recognize that they're in the presence of damaged cells, and they release growth factors to trigger the healing. Healing power of nature. I mean, this is right. This is the ultimate naturopathic biohack. So, but if you go in the middle, above the mesenchymal, below the embryonic are these VSELs, and there's very little data on them, and it's a brand new field, but we think that these actually have the ability, because they're primitive enough, to turn into target tissue cells. Thank you very much. So I had known about it for a period of time, but I never did it because the only method, because these cells exist in your blood, but they're completely quiescent. They're hibernating. They're not activated. So if you do like a platelet-rich plasma, you're concentrating them, but they don't do anything because they're asleep. So I'd heard about these ways you could like freeze and thaw the VSELs, but it took like 10 hours, and when you keep blood overnight, now the FDA considers you a blood bank, and that's a whole other ball of red wax, or red tape, rather, I'm sorry. Red wax, okay. There's something there. So when Dave Asprey on a Sunday cold called me, and normally when I talk to Dave, like we arrange our assistants, like it's scheduled, but I just looked, and it's like, oh, Dave's calling. He goes, Harry, there's this new technology to activate VSELs. You need to be one of the first people to do it. So he introduced me to this guy, Todd Ovokaites, who practices in southern Florida, who has developed a laser that, it's actually not even a laser, it's a filter. He calls it a holotropic filter that activates these VSELs. So you take a PRP, zap it with this laser, and before the zapping, he has got peer-reviewed, published data showing before zapping it, you measure the number of VSELs, and then when you zap it with the laser, they grow like 100x. So that means they're activated. We've started using it about a year ago, and we've been very, very happy with it. And Amy Killen put your hand up, Amy. So you could ask her too. We work together, and she's been using them as well. So back to those years that I was commuting to South America. So part of the reason for that was because there were so few people in the United States doing it. I needed mentors, and so I was traveling to South America. And stem cells was super. This is back like 2010, 2011. Stem cells were super hot in Brazil. No one had heard of it in the U.S., but it was hot down there. So some of these doctors said, "Hey, why don't you just come down once a month, and I'll line up a bunch of cases." So I had this circuit that I would do. It was Bogota, Colombia for my patients who wanted culture expanded cells. Then it was Ecuador, Guayaquil, Ecuador. Worked with an orthopedic surgeon, and I would collect and prepare the stem cells. He would use them with orthopedic surgery. Then 3 cities in Brazil, and then I would always top the trip off with some kite surfing, because they got pretty good kite surfing in Brazil. Yeah, there's the kite surfer over there. But when I would come home to the States, what's interesting is my patients were almost 100% cowboys. And the reason for that is because back then, in like 2011, 2012, the people who were mostly doing bone marrow stem cells were veterinarians, large animal veterinarians. So these guys had these expensive workhorses who would get too old to work, and they'd kind of want to get a couple more years out of them. So they'd take them to this guy, and he would do bone marrow stem cells on the horses, and suddenly they would get like 2-3 more years of work out of them. And so they'd see this with their own eyes, and they'd say to the vet, they'd say, well, can't you just do that to my low back and my neck? And the guy would say, well, no, I can't, because I'm a veterinarian, but there's a guy in Park City who's doing it now. Go to him. So during those years, if you look back on my YouTube page with my patient testimonials, this is from like the videos from like 10 years ago, they're all cowboys, every single one of them, ranchers, wranglers, cowboys, ex-rodeo, that kind of thing. And these people have arthritis throughout their entire bodies because they've worked their asses off nonstop, not taken any rest days. And so they literally had arthritis through their whole body. So I would do these big treatments. I do their whole spine, and I do both shoulders, and I do both hips. and I do both knees. And I just like totally, y'all, as a joke, I used to call it full body stem cell makeover, like tongue in cheek, just like as a gag. Well, then in 2016, February 29th of 2016, this guy became a patient. And I started getting his followers. I've learned about the whole field of biohacking. And I started getting people coming in interested in longevity. And they'd say, can't you just like do my whole body in a single sitting? And I thought, I wanted to say, you could go to a guy and I thought, well, there's nobody doing that. And I thought about it, and I said, shit, yeah, I've been doing it for years. So one of the first people to receive it was Ben, and he did his first one close to 5 years ago. He did his second one just like 2 months ago, and this is an actual video of the procedure that we did, was it March 22nd, I think? So with Ben, usually I aspirate fat, but Ben doesn't have any fat, so we just used bone marrow. We used VSCLs. We spin the bone marrow, add ozone gas, add in the VSCL, do epidurals at 3 levels. Then I do facet injections at every level. And he's asleep for this. So he's completely doesn't feel a thing. Amy Killen, you might have just seen her duck in there. She does the scalp for thicken the hair follicles. Flip the person over, both shoulders, both elbows, both wrists and thumbs, both hips, both knees, both ankles, and great toe. Then Amy comes in, does the skin of the face and the neck, and that's to improve elasticity and hydration of the skin, which is something that neither Botox nor filler nor facelifts do. It just improves the health. Then she finishes it off with, as Ben mentioned, in men, the penis, and women, the vagina, which is to optimize sexual function. Because in men, erectile dysfunction is a circulatory disorder. So even if somebody doesn't have it, we're hopefully preventing it in the future. And with women, that as women age and especially go through menopause, and of course there's hormonal issues as well, but that loss of elasticity is what causes when women have pain with sex. It's because of the loss of elasticity and hydration of the skin. So that's what we've been doing is Amy and I do that 4 hands full body stem cell makeover. And is Marcella in the room? Oh, hey, Marcella. So Marcella Madera she's a Johns Hopkins trained neurosurgeon, spine surgeon. So she's like a real doctor. And she realized that doing surgery is dumb for the most part. I mean, there's some that are totally necessary, but most of them don't help. So Barry Morgulin introduced us. She's one of the tops. For those of you who know Barry Morgulin, he's sort of the energy doctor to the stars. But he introduced us. And so she's developed this amazing new method called the Aqua method, which is basically like the non-invasive version of full body stem cell makeover. It's 3 days. She works with a chiropractor. She works with a physical trainer. They do this very customized treatment where they really evaluate people and then customize the treatment for them. It takes 3 days, and then we get you on day 4 to do what you guys just saw. I'm very excited. We're offering our first one the week of July 11th, and we filled it up in like 2 days. So yeah. Chronic pain doesn't kill you generally, and that's why it doesn't get the research dollars that cancer gets, that heart disease gets, that diabetes gets, but it can destroy your quality of life. And if your purpose in life in any way involves the use of your body, then chronic pain runs the very real risk of robbing you of your purpose in life. And so when that finally dawned on me, I had a bacterial infection of my heart. I guess it was 5 or 6 years ago. Had a stroke, was completely paralyzed on the right side of my body. Lost the ability to speak. I ended up having to have a valve replacement. It turns out it was from bad dental work, so get your teeth checked, But when I was recovering from that, I was laying in the hospital bed going like, what's the healing from, open heart surgery? Like, I got to experience pain that was a 10 out of 10, and I had never had that before. And I was like, okay, what is the lesson here? Why am I doing this? And it became clear to me that the greatest advancement in medicine doesn't do anybody any good if they can't afford it. So we developed the tithing program. So the tithing program is available to people who otherwise wouldn't be able to afford it. But there's 2 pathways for enrollment. One is I will do it combat service veterans. I'll do it no charge. We do 1 day a month. Similarly, I will do it in exchange for community service hours. And the reason I mention this is I know there's quite a few doctors in the audience, please rip off this model, because I learned it from someone else. I ripped it off someone else, and she invited me to rip it off. I have a film. It's called The Stem Cell Solution. You go to stemcellsolutionfilm.com. It's free to watch. I would love it if you guys would see it. It sort of tells the story and has a bunch of interviews. The photo that I showed in the early part of me climbing, a couple of years ago, I got kind of self-conscious about it because that's like a 20-year-old, it's actually a little more than 20-year-old picture. And I thought, it's kind of lame to put an old picture of myself when I was a kid. So I went back to that same boulder and did that problem last year with my fan club. Those are my 2 daughters. And on that same trip, my 6-year-old, I actually was 5 at this time, she was, I've got them, I share with Ben that I think it's important to do dangerous stuff with kids. That's like part of parenting. Like, it's okay to do dangerous stuff. And so anyway, she was doing this problem, and it's on an arête, which means it's on an outside corner. So what's interesting about climbing an arête is, normally if you're just on a wall, it's like you see the rock in front of you. But when you're on an arête, there's rock, but then you see how high off the ground you actually are. So it's more intimidating. So little BB, she's a shrimp like me. She's this tiny little thing. She'd make a couple of moves, and she'd stop, and she'd go, and then she'd make a couple of moves, and she'd go, and I lowered her down, and I said, "Baby," I said, I gave her a big hug. I said, "Were you a little bit scared?" And she goes, "Daddy, I was scared, but I just told myself it's okay to be scared sometimes." And that's how I felt. I have succeeded as a parent. I can go to the grave knowing that I've left the world a better place than I found it. Thank you very much. I'm sorry for going a couple of minutes over. I love you guys. I really appreciate it.